My name is Luke Schellenberg. I'm an ENT doc. So I wanted to talk about head and neck cancer. This isn't a very common topic. It's not a very common thing. Head and neck cancer is something that we see as ENT doctors occasionally. If sometimes patients say, I've got a mass in my mouth or a mass in my neck or something like that. And the most common type is squamous cell carcinoma. Interestingly, squamous cell carcinoma, you would think the incidence would be decreasing. And the reason for that is, in the past, we've really seen that it is highly correlated to smoking and drinking alcohol. And the incidence of smoking in the United States, at least, has dropped quite a bit over the last 30 years. There's a lot less people smoking than there used to be. What's interesting, at least in some types of head and neck cancer, is that the incidence of squamous cell carcinoma is actually staying the same or even going up a little bit. And the reason for that is because we found that in certain types of head and neck cancer, specifically cancers in the oropharynx, which is where the tonsils are, the back of the palate, the back of the throat, but not the voice box and not the mouth itself, is related to HPV. And HPV is human papillomavirus. And so a lot of patients are like, what? I thought that was like supposed to be down there. And so no, it's actually something that can be found in the throat, and interestingly though, not necessarily on the tonsil, on the tongue or in the mouth itself. It's at the back of the throat. And so there's been kind of this back and forth. Is this always related to a sexually transmitted disease, or could it be passed on from mother to child? And there's still been a lot of questions related to that, because there are patients who have HPV who aren't sexually active. So got to be getting it somewhere. And so maybe it is getting passed even just through kissing somebody else who has HPV. The long and short of it is, even though the cancer incidence is slightly increasing, the prognosis is much better. And so the prognosis for HPV-related cancers, the term we use is P16 positive head and neck cancers, the prognosis is much better than P16 negative. So it's never good to have a diagnosis of cancer anywhere, but if it is P16 positive, you have a much higher chance of it being successfully treated, even up to 90% success rates. And some patients have asked, well, does this mean that we should be undergoing the vaccine for HPV? And I would say yes, because the fact is, number one, it is not always an STD-related issue. Number two, it's actually more common in men than in women. And so HPV-related head and neck cancers are more common in men than in women. So I'd recommend getting HPV vaccines, because no one wants to get cancer related to it. So anyway, that's a little bit about head and neck cancers, and around kind of what's interesting about, you would think that the incidence be going down, but it's actually going up. But some way to avoid it is to get vaccinated, okay?